Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, TGIF edition. Tonight, we're going to be talking a lot about the screening guidelines and symptoms for March is Colorectal Cancer Awareness Month. It's hard to believe, but here we are, March 2nd, another year. And it's a nice time to kind of learn a little bit about screening guidelines and symptoms, like I said, for rectal cancer. So tonight we have on the program Dr. Andrew Awick. He is a GI, I'll say that, because he's a gastroenterologist. There, I got it right for once. With digestive care, and also on staff at Delray Medical Center and Boca Regional Hospital, right here in Boca Raton. So that's fantastic. Dr. Awick, welcome to the program, and thanks for joining us for Colorectal Cancer Awareness Month.
Thank you for having me back, David. It's an honor to be here again.
Thank you. And, a very important topic. Actually had a family member who actually recently was diagnosed with colorectal cancer, but everything's going good so far. So we were talking a little bit in the green room there. This is a cancer that's been very prevalent lately in older people, but also in younger people as well. You were mentioning before that it's kind of rising in certain parts of the age population and declining in others. Can you just elaborate on that?
Well, what's been happening over the last 30 years or so, as we have done a better job of screening for colorectal cancer, is that we've found over time that the incidence of cancer in the middle age group, 50s, 60s, 70s, has been declining, which is good. But unfortunately, the rate of detection of colon cancer, the incidence of finding colon cancer in younger people under the age of 50, even in their 30s, is rising at a rate of almost 4% a year. It's startling why this is happening. It's only speculative, but there's a push now to start screening at a younger age for many people, but also to make community doctors and younger people aware of the signs and symptoms of colon cancer, so that it won't be too late for them, that if they start to have any symptoms at all, they know to see their doctor and get proper testing, and it can be identified earlier.
And when you say speculative, that's something that just hasn't been researched yet, so it's just going to take time to really find out what actually is causing the younger population.
Well, unfortunately, the leading theories are for the same things that are causing a lot of problems in people's health for everybody. Obesity, consumption of too much red meat, perhaps even food additives or chemicals are thought to be part of this, is why we're seeing it a little bit in younger people.
Okay, and we're here with Dr. Andrew Awick. He's a gastroenterologist here in Palm Beach County. One of the questions I had when I was researching a little for the show, I actually went to the American College of Gastroenterology, ACG, to get a little bit about their recommendation timeline, and I think I learned something. There is a preferred cancer prevention test, and then there's also a colorectal cancer prevention test. Are those two different tests? What kind of tests should we be looking for? I always see age 50 to maybe it's time to have a talk with your primary care physician or GI about having a checkup for the...
Yes, you're right. The guidelines for screening for colorectal cancer were updated last year. What I think you're talking about is the new joint multi-group task force. Is where the American College of Gastroenterology, the American Gastroenterology Association, and the American Society for Gastrointestinal Endoscopy, these three organizations put all their brains together and came up with their updated recommendations for 2017. And right now, as it stands, what you're describing is that there's two different approaches. There's cancer prevention and there's cancer detection. And what the ACG and the task force really is trying to push is the idea of really cancer prevention. As it stands right now, the the data and studies have shown that the best way for cancer prevention, or as we call it, cancer screening for colorectal cancer, is still to have a colonoscopy performed. And for people who are of average risk, those are people who have never had polyps in their colon found before, or don't have relatives with strong histories of advanced polyps or colon cancer themselves. These people start at age 50, and the recommendation is every 10 years to be screened with colonoscopy up until the age of 75. If at age 75 in your history you've never had polyps found, most people would recommend that you can think about not screening anymore. But here's the rub, we're all living longer. So the newest recommendations state that if you are, age above 75 and it's your time for screening, if your life expectancy is thought to be at least 10 years, as often it is now for people living into their late 80s and 90s, you should still have a regular screening colonoscopy. Of course, it's up to the doctor's discretion if you're in good enough health to undergo this invasive procedure.
Thanks for clarifying that. You're right. I had flubbed at colorectal cancer prevention tests versus the cancer detection tests.
Right. Cancer detection tests, what they're talking about, are tests that are designed not to find the precursor lesions. They're not very sensitive to find polyps, which are the beginning of the problem before it turns to cancer, but to find the cancers themselves. And the recommended cancer detection test for those people who are unwilling to or for other reasons cannot undergo a colonoscopy is what's called the fecal immunohistochemical test, or the FIT test. It's basically a test that is very sensitive at detecting blood that's in the stool. So it's a stool test. It's very easy to do. It only costs $20, is paid by most insurances. And it's recommended on a yearly basis for people age 50 and over who cannot or will not do a colonoscopy. That is a cancer detection test, because the sensitivity for finding polyps, early lesions, is not as good as it is for if you actually have a lesion in you.
Oh, wow.
Such as a cancer. But it's still very sensitive and a very effective way to screen groups and populations. And in the future, we may be going to that sort of a strategy of, finding groups and offering this as a general part of your health maintenance, where perhaps your insurance company will be mandating that your primary doctor do this test every year rather than using colonoscopy. But for now, colonoscopy is still considered the gold standard and most recommended and best test, because not only can you find the precursor lesions to cancer, the little polyps in your colon, you have the opportunity right then and there to remove them and therefore alleviate the risk.
And we're here with Dr. Andrew Awick. He's a gastroenterologist with Digestive Care. They've got a great website where I get a lot of the information I'm asking him, lovemygi.com. He's got office locations in Boca Raton and Delray Beach. Like I said, he's on staff at two local hospitals, Delray Medical Center and Boca Regional Hospital right here in Boca Raton as well. And Dr. Awick, one of the questions I wanted to ask you tonight is there's a little bit of a stigma for people who haven't had a colonoscopy, that first one. Can you tell us a little bit about, the preparation, the actual procedure? Because I think sometimes people are scared to get their first one, maybe.
Sure.
And the word colonoscopy, so it's a scope that's used, right?
Let's be honest. Colonoscopy is exactly what most people think it is. You're putting a practically a 5-foot tube up someone's bottom and around their colon, goes around 4.5 feet. So there's obvious trepidation about having someone, put an instrument up your bottom. But people are cautious or afraid about colonoscopy for very different reasons. Some people are afraid because they're afraid of the sedation. They don't like the idea of being put to sleep, as most people are for a colonoscopy, because it is uncomfortable. So we use sedation. We put people to sleep for this for a short period of time. The average colonoscopy only takes anywhere, from 12 to 20 minutes on average for most people, you're not asleep very long. And the sedation we use now is very quick and clean. You fall asleep within seconds of getting it, and you wake up very quickly and are wide awake. And I tell people you're going to wake up and feel exactly the way you do right now when I'm speaking to you, except you're going to be done. And you'll be asking, well, doctor, when's it done? And I say, we've already done it. And people are shocked by this. It's that good a sedation that we use now. Other people are afraid of colonoscopy because sometimes they just don't want to know. And that's where education from the primary doctors and the media and the medical societies are important, so people can get over that fear of knowing. But I think the thing that scares people the most, that people don't like the most, is the bowel preparation. That's the part, because in order to do a high quality colonoscopy, you need to be as clean inside as possible. That's really even a measurable guideline now for gastroenterologists, and what we do is how clean is the bowel prep. We've even started grading the bowel preps for statistic keeping. So the cleaner you are, the better a chance that the doctor is going to be able to see a tiny little polyp. And we're talking about lesions that are anywhere, from 2 millimeters to several centimeters in size. We're looking for something that'll fit on the head of a pencil, is what we're looking for to take out. Those are tiny little polyps. Now, not all polyps become cancers. The bigger they are, the more likely that they are precancerous and will develop into cancer. And that usually happens in polyps that grow over the size of 5 millimeters. When they start getting bigger than 5 millimeters, you start getting more concerned, and especially if they're 1 centimeter or bigger. But getting back to the question about the bowel prepping, that's what people don't like, is because you have to be on a clear liquid diet for the day prior. You have to take any one of a number of different types of laxative solutions to drink. Some are more palatable than others. Some are more effective than others. And really, you're going to spend a lot of time in the bathroom eliminating the stool out of your colon. And that's no fun for people. We're giving you diarrhea for several hours. And most people lose a little bit of sleep the night before because they may be up in the middle of the night still passing stool out. But it's really a necessary evil. It's not the worst thing anyone's ever going to do in their world. And really, if you get a good test and, God forbid you find something or you find polyps, that's what the test is for, to find them before they become cancers, get them out so you don't get colorectal cancer. Colorectal cancer is the second leading cause of cancer death in America in men and women combined, just behind lung cancer. And last year, it took an estimated 50,000 lives, with an incidence of 135,000 new cases diagnosed. With colonoscopy or other screening methods, we have dropped the incidence of cancer at least 30% since 2001. So we've done quite a bit to improve people's odds by doing colonoscopy on a regular basis, on a schedule for those who need it. But the first step is getting that colonoscopy done the first time, coming in at age 50, sometimes even younger, depending on your circumstances, to establish your risk. Because if you have your first colonoscopy and you find some polyps, you're much more likely to have polyps or develop cancer in your lifetime. And that lets doctors screen you a little bit more intensely, a little bit more often, to find these polyps, take them out so you never get cancer at all.
And we're here with Dr. Andrew Zwick. If you have a question for Dr. Zwick, number's 1-888-565-1470. We'll be on the air until almost 6 o'clock this evening. So if the question's appropriate, just call in or ask on Facebook Live. I see we have 11 viewers right now on Facebook Live's All County Healthcare page. All County Healthcare INC is sponsor of the show, so thank them as well. If it's appropriate, I will get it on the air, and you can I can pose in front of Dr. Andrew Zwick, GI with digestive care. One of the other questions I had, and I had read this, and correct me if I'm wrong, but are African Americans at a higher risk for colorectal cancer, and should they be screened maybe at an earlier age, like 45, I saw?
Yes, the newest recommendations are that African Americans are at higher risk, and is recommended to start their screening at age 45.
Wow. Okay. So that's through the the clinical research and the studies that doctors like you
Yes,
have done that you
true.
found out. Wow.
That's true. And in fact, the recommendation to start at age 45 even applies in a doctor's judgment for people who might be at high risk if, of course, they have other risk factors. And although there's no clear-cut recommendation.
Raising my hand because I'm a little overweight,
Excuse me,
obviously.
yes. Although
a
there's
lot
no
overweight.
there's no clear-cut recommendation. Obesity, smoking, people who or drink alcohol to excess, people who eat a lot of red meat. These are risk factors for development of colon cancer. It's not a clear-cut, definitive recommendation, but it is suggested to think about perhaps screening these types of people a little bit earlier, starting at age 45.
And we got about 15 seconds to our first break here, our first and only break. On the other side, I'm going to ask Dr. Awick, who's at risk for colon cancer, meaning family history. Does that play a role? And I'm going to go a little deeper into the symptoms of colon cancer on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida and beyond, and welcome back to the How to Stay Healthy show. We got Dr. Andrew Awick in studio, a GI in studio during March's Colorectal Cancer Awareness Month. I can't thank of him enough for hopping aboard on this adventure of health that we're always on. Dr. Awick, we talked a little bit about the break, family history and genetics. Do those play a role in colorectal cancer?
Absolutely. As per guidelines, and what we've learned is that if you have family members who have had polyps detected or have been diagnosed with colorectal cancer before, it does put you at higher risk for developing it yourself. We stratify people into risk based now on the number of relatives who've had cancer, but also the type of polyps that they've had. We call the bad polyps advanced adenomas. Adenomas is the medical name for a precancerous polyp. And it comes in different types of adenomas. But for the purposes of tonight's talk, we'll just call them adenomas. And if you have one of these adenomatous polyps in a relative, it used to be that we would start screening you at age 50, and we would recommend every 5 years to have a colonoscopy done for screening, as long as, especially if you have polyps yourself. However, the recent guidelines have found through epidemiology and studies that just having a family member who has a precancerous polyp itself is not enough to increase the risk. Polyps are just common enough themselves that it doesn't increase your risk per se, and you don't have to necessarily screen every 5 years. If you don't have polyps, you can continue screening it every 10 years. But now they've stratified it into people who have had relatives above or under the age of 60 who have had colorectal cancer. To be specific, if you have a first-degree relative, that's a mom, dad, brother, sister, who had colorectal cancer younger than age 60, that is enough to put you at higher risk. And it's recommended that you start your screening at age 40. And if you find that you have no polyps at that point, then you may continue your screening every 5 years. If you have a relative who had an advanced adenoma, okay, just one relative with an advanced adenoma, that's considered the same as, over the age of 60. That's also considered higher risk. If you have two relatives who've had colorectal cancer, you're definitely at risk. You start early and it's every 5 years. The same if you have two relatives who've had advanced adenomas. The problem with this is that most people don't know what kind of polyps their relatives have had. They don't have access to the pathological specimen reports to see what they were, how big they were. Most people barely know whether their own mother, father, brother, sisters even had a colonoscopy. But if that information is available, it'll help your doctor to decide what's right for you. So the family history does put you at increased risk, but not quite as much as it did before, because now small adenomas are not considered to be increased risk per se as they were previously.
We were just talking about this because I was trying to, I have a family member who had colorectal cancer, and I was trying to, and I couldn't figure out what kind it was, to be honest with you. We just talked about this, not about the case, but I was trying to figure out and ask the doctor some questions, and I have no idea what they had, to be honest with you.
Well, for instance, you said you had a family member who's had cancer?
Colorectal cancer.
Who was that?
My mom.
And how old was she at her diagnosis?
I was trying to count the numbers when you were saying that. I want to say it was 65-ish, but I feel like she had it before then. But I don't feel like it was before 60, though. Yeah. I'll have to ask her.
If it was after 60 and you don't have any other relatives who have had advanced adenomas, which are big polyps, or polyps that are showing changes in their cell type that make them look like they're going to turn to cancer sooner, we call that dysplasia. If you don't have those types of relatives with those history, then you should be starting your screening as per current recommendations at age 50.
Okay.
Because the one relative does not put you at higher risk. But if that relative was under the age of 60, then it's considered higher risk.
Okay. I'm going to go ask her about her parents too as well, because I think that's good to ask. And now I know why when at primary care visits, the doctors are asking so many questions about family history, because if there's a flag there, then they're going to refer to someone like yourself for a colonoscopy.
Yeah, you can't outrun your genetics.
Yeah.
And one of the biggest challenges I have is getting people to call up their sisters and brothers who are older, sometimes younger, and asking them, "Have you had a colonoscopy yet? And what did they find?" It's really amazing to me how people don't know about their own family history. People don't always talk about these kinds of things because of the nature of the conversation. No one wants to talk about their colonoscopy. I can understand, but it can save a life.
Yeah, that information could be so helpful to you and help you get to the answer more at a quicker pace, right?
Yeah, I always request my patients to said, you need to go home tonight and call your siblings or call your mom and dad and ask them these questions. It'll help me help you.
Nice. Now, I know you want to talk a little bit about polyps and numbers and symptoms. So I think we have looks like we have about 7 or 8 minutes left, maybe a little less. Okay. So if you want to just go into that.
Well, we've talked about, polyps and the importance of getting them out because these are the precursor lesions. But what I'd like to emphasize is something you brought up at the beginning of our conversation, is that we are finding younger people getting colon cancer. And although the screening guidelines have not been specifically changed, certainly if people have risk factors or symptoms that warrant a colonoscopy, they should get one. And what I'm talking about is if you're an average person and you suddenly experience a change in your bowel habit, suddenly someone who may have a regular bowel habit, move their bowels comfortably once, twice a day, whatever may be normal for you, whether it be once a day or, twice a week, whatever. If there's been a sudden change and that change persists, that's something you really need to go talk to your doctor about. because that doctor will most likely want to perform a stool test to see if there's blood. And the preferred stool test, as I said before, is called the FIT test. We no longer just use the old stool guaiac cards that you've seen perhaps in the office. You take a little stool sample, you smear it on the card, drop some chemicals on it, makes a color change. That's not the preferred and recommended method. The doctor should be requesting a FIT test if you've had a change of bowels or any other important changes in the shape or content of your stool. If you're losing weight, if you suddenly feel fatigued, they should be checking to see if you're anemic. Often the first sign is anemia because of chronic but not visible blood loss from a tumor. If you have a positive FIT, you're a young person, you find that test, it's positive, you should be investigated to see if you have cancer or perhaps some other source of bleeding until you find where that blood's coming from. Even if it's not a colon cancer, it needs to be investigated. If you have a negative FIT with bad symptoms, then you really aren't at that much more risk, and the doctor can pursue other reasons for why you've had this change.
I see.
So the message I want to get out is that if you develop new symptoms, new diarrhea that is not obviously from an infectious illness or something you ate and transient, but persistent, or constipation, abdominal pain, obvious blood in the stool. If you're not used to seeing any red blood when you wipe your bottom, which of course could just be hemorrhoids, but could also be a bleeding colorectal cancer. If you see these changes, go see your primary doctor or a gastroenterologist. Get it checked. It's easy to do. It can save your life.
And we're here with Dr. Awick. We got about a minute left. Hard to believe that, but we got some great information tonight on Colorectal Cancer Awareness Month, which is March 2018 right here. Dr. Awick has an office 5258 Linton Boulevard, Suite 202 in Delray Beach. And then also 951 Northwest 13th Street, Suite 2E in Boca Raton.
Right.
Correct?
A stone's throw from Boca Regional and a stone's throw from Delray Medical Center.
Yeah, I was going to say that. And go to lovemygi.com. Dr. Awick is trained and experienced as an endoscopist, which is critical to do a thorough colonoscopy. So if you have any questions, give a call to his office. Check it out, lovemygi.com. Thank you so much for coming back on the program.
It's a pleasure, David. Thank you for having me.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and